Recently, a teammate reached out regarding training Jiu Jitsu when diagnosed with osteoporosis. Osteoporosis is a medical condition where the skeletal bones become weak and brittle, dramatically increasing the risk of fracture. There are several risk factors for osteoporosis that cannot be modified, including female sex, increasing age, Caucasian or Asian race, a family medical history of osteoporosis, and being small-framed. If you've been diagnosed with osteoporosis and want to continue training Jiu Jitsu, here are some practical tips. First, see your medical provider on a yearly basis to rule out or monitor medical conditions that can contribute, such as fast thyroid function, called hyperthyroidism, fast parathyroid function, hyperparathyroidism, low vitamin D levels, which are very common in the Chicagoland area because of the long winters, slow kidney function, celiac disease, inflammatory bowel disease, rheumatoid arthritis, cancer. Going into menopause with decreased levels of estrogen can contribute to osteoporosis. Also, yearly labs to rule out or monitor conditions which are contributing, including a CBC to look for anemia, comprehensive metabolic panel to search for prediabetes, diabetes mellitus, liver kidney function, calcium levels, a TSH to monitor thyroid function, magnesium level, vitamin D level, PTH level to monitor the functioning of the parathyroid glands. In addition, your primary care provider will be ordering a DEXA scan, DEXA, DEXA bone scan, on a regular basis to monitor the density of the skeletal bones. Some other tips include a healthy diet, fruits, vegetables, lean meat, fish, chicken. Staying active 7 days a week. Limiting or avoiding alcohol altogether. Limiting or avoiding the use of tobacco altogether. Limiting or avoiding medications that can contribute to osteoporosis, such as prednisone or proton pump inhibitors for esophageal reflux, such as Prevacid, Prilosec, Protonix, etc. Medications that may be prescribed by your doctor include vitamin D supplement, calcium supplement, multivitamin every day, and medications to either maintain the integrity of the bones or actually build bone, such as Fosamax, Prolia, etc. There are many out there. Before you step on the mat, try to engage in a reasonable strength and conditioning program on a regular basis and a reasonable mobility and stretching program on a regular basis. When you do step on the mat, warm up and cool down properly before and after training. Avoid or limit stand-up. It is very dangerous to train stand-up, whether judo throws, wrestling, or starting a roll standing. It'd be very easy to fracture a hip or a vertebra in the low back. If at any time you feel pain in your low back, your hip, or any other joint, stop training and see your doctor. He or she may want to order an X-ray immediately to rule out a chip fracture or any kind of fracture of the weak and brittle bones.